Hey guys, I know I got cameras and mics off, but you can hit the chat box if you need anything. We'll be getting started soon. Try to see if a couple more people are going to filter in. What's up, guys? We'll be getting started soon. Just going to let a couple more people filter in before we get rolling. Uh, Chat box is open. We'll have mics and videos turned off for now. I'll turn mics on towards the end when we have like questions and stuff. But if you do have questions or anything as I'm going through stuff, feel free to just throw it in the chat box there. No problem. So I know we just got a few of you on here right now, but if anyone here is dealing with low back pain or specifically low back pain that is affecting their training, go ahead and just throw it in the chat box if that's something you're dealing with, or if you know somebody that you're dealing with that's dealing with it. So off and on, we got an off and on issue. Pretty common for sure. We'll make sure we're addressing that too today. Family members. As a PT, I also hear it commonly from family members, especially at holiday events. Like I said, we'll give a few more minutes and then go time, baby. Welcome, Ward. Welcome. Now, has anybody here had PT for low back pain before? Or traditional PT, where you're going to the outpatient clinic, there's like 160 people in there with you? That's true. I was your PT back in the old spot. All my people are coming to join me. I love it. But all right, guys, I'd say it's about time to get started. We're 3 minutes, so we'll get rocking and rolling here. So welcome to actually my first webinar with Function Reforged, my PT company. So we're talking about low back pain and training today. So kind of what the plan is today is we're just going to do a brief intro on the topics, on myself. I want to go through just some brief spine anatomy so you guys have a little bit of an understanding like of the spine itself, because I think that is important. Not going to be like an anatomy quiz or anything like that, but just enough to not even make you dangerous, but just to know that you're resilient, and you should feel empowered when you're leaving this. That's kind of the goal. We're going to go over some of the common causes of low back pain, what to do if you're experiencing low back pain, and then how to go about training when you're having low back pain, right? That's why we're all here. So, a little bit about me. I am Jared Caroff. I'm a doctor of physical therapy. Got my degree at Wingate University. I'm a competitive powerlifter. I've competed in a lot of sports, everything from wrestling, track and field, competitive arm wrestling, tons of stuff. I currently live in Pittsburgh, and that's where my practice is out of, here on the north side of Pittsburgh. I'm happily married. I'm a dog dad of 2 now. We just got a puppy. Big time nerd. I love all my, Lord of the Rings, anime, all that stuff, and I love fitness. That's what I'm here for, right? So a little bit about my practice. I actually started it last year, and I run it here out of Union Fitness. That's where I'm at now in my office. I specialize in athletes. I specifically see a lot of lifters and runners. And what I do differently, so I worked in the basic outpatient world for like 3.5 years, and somebody in here actually saw me while I was working there, which is kind of fun. But I don't bill insurance, right? And what that allows me to do is see people one-on-one, and spend as much time with them as I feel like they need, so I can really personalize their therapy programming to them. When you're in a basic outpatient clinic, if you've ever gone for anything, you probably get about 10 minutes with the physical therapist, and then you may or may not see an aide or a PTA, and the therapists are just running around like chickens with their heads cut off, trying to spend a little bit of time with everybody, and all the other patients are just walking around the gym trying to figure out what to do on their own. It's a little chaotic sometimes. So I didn't like that. So I started my own thing so I can treat who I want, how I want, and really give people the time that they deserve. So let's dig in a little bit. The spine. So your spine is really just one long thing, we'll say, right? It's a series of bones that go down. We kind of think of it as one piece, but really you have 7 cervical vertebrae, 12 thoracic vertebrae, and that's like where your rib cage is, and then 5 lumbar vertebrae, which is what we're focusing on today, the low back. Right below that is your sacrum, which is kind of a big chunk of bone that is a fusion of actually 5 bones. And then below that is your tailbone, which is called your coccyx. It's also a fusion of little bones. We're not trying to memorize all these today, but the focus is going to be, if you've seen that picture, the lumbar vertebrae, L1 through L5, because we're talking about low back pain. Now, specifically with the low back and the vertebrae, an important thing to kind of remember when it comes to this is the low back, the lumbar vertebrae, are good for bending forward, bending backwards, and bending side to side. They don't do a lot of rotation. The rotation comes from the mid-back. So when we have like rotary movements that hurt, generally speaking, you're not getting a lot of that rotation from the lower back. So the muscular anatomy, we're not going to go through every single muscle here. What I really wanted to pull this up to show you was how many muscles are attached to your spine, and with that, how much protection the spine has, right? So you have little muscles that go in between. Like if you look at the far right picture, there's tiny little muscles that go in between the small like bones between each vertebrae that help stabilize it when you're bending to the side, rotating, bending forward, bending backwards, really anything. And then you have really large muscles that go on either side of your spine called your erectors, which are, the big muscle straps on either side that go up that you can generally see on people. On top of that, the muscles in the front of our trunk, like our abs, right? We have our obliques, our rectus abdominis, which is our 6-pack muscle, and then our iliopsoas, which is a hip flexor. The psoas muscle attaches directly to your spine, way deep beneath your guts down there. So you have a lot of stuff that is there to protect your spine. It is not a fragile structure at all. It houses our spinal cord. So, the creator did not make it so that it's supposed to be fragile. Otherwise, none of us would be walking right now. Another thing that I think is really cool is the ligament anatomy. So the purpose of ligaments is to keep joints together, right? And for all intents and purposes, each vertebrae, when it's on top of another vertebrae, kind of creates a joint, right? So, and there's bunch of joints, like with the different bony attachments between the two, but they all have ligaments associated with them. The amount of ligamentous structure you have in your spine is significant. Again, your spine is not fragile. If you even look in this picture, all the gray stuff that's in there, that's all ligaments. So that prevents your spine from falling apart. It's really hard to get through that stuff. In PT school, we had to do cadaver labs, and I actually worked as a GA in the cadaver lab. And, on dissection, you go through the spine, and the ligaments are really, really tough. So not only are you getting through all the muscle tissue, but when you get down to the ligaments, it's really hard to even get those apart to look at the individual vertebrae. So everybody's favorite thing to talk about when it comes to low back pain is the discs. So for our purposes, the two parts of the disc we're going to talk about are the annulus fibrosus and the nucleus pulposus. The annulus fibrosus is just kind of like a hard outer portion, right? So think of it almost like we'll use a jelly donut as an example. It's a bad example, but we'll use that as the example. So the annulus fibrosus would be the outside, and then the nucleus pulposus would be the inside. Really what it is kind of like tire rubber and then chewing gum on the inside. So it's really resilient stuff. The cool part about the annulus is it has multiple layers stacked, one in front of the other, and they actually go in opposite directions. And believe it or not, that's actually how we decided to structure, like when we decided to create tires and build them very resiliently, we actually used the structure of the annulus fibrosus as an example of how to create that type of structure so that it's really hard to pop tires. The nucleus pulposus, the chewing gum stuff on the inside, or the jelly, it's really good to just provide strength and flexibility and help force disbursement. So when you're carrying things, jumping, landing, running, whatever, it takes those forces that are dispersed through your spine and ships them down and allows it to be evenly distributed. All right, into some common causes of low back pain here. So muscle strain, just pulling a muscle, tearing a muscle. I'd say that's probably the most common. You go to pick something up and something pulls. I did that recently. It happens. Fractures, just breaking a bone. So this could be a small insignificant type fracture, on a smaller piece of the vertebrae, something that would be called like a spondylolisthesis, which, generally speaking heals pretty well with conservative treatment. Or you can have more significant fractures like compression fractures that we see in people with things like osteoporosis. Joint dysfunction, just inflammation within the joints of the vertebrae where they connect. Disc injuries, we all talk about disc herniations and disc bulges. Stenosis, which we'll get into in a little bit. Arthritis, which is just joint inflammation. And then nerve pain that could be coming from the low back. So before we get into some of the diagnoses, I wanted to go through some of the scary words that you guys might see. So if you've ever gone to the doctor for low back pain or had any imaging done, more than likely you have probably seen one of these words on your sheet, right? You get the imaging results back and you get one of these words back. So spondylosis is just arthritis, right? Age-related changes more than likely. Spondylolysis is a pars fracture. So we were talking about a little bone that's breaking in there. It's called your pars articularis, and it breaks. It's actually commonly seen in like gymnasts. Spondylolisthesis is when you have the fracture with the slippage. So it would like slide forward on the other one. Again, that's something that can be treated with conservative treatment like physical therapy. Nothing that needs surgical intervention right away. Disc bulging, it's just when that annulus fibrosus is being pushed out a bit by the nucleus. Nothing has blown out of it. It's perfectly, fine. In fact, a lot of us have those. Disc herniation is actually when the nucleus pulposus or the jelly has like pushed out and through the annulus, and disc herniation with sequestration is when a lot of it has pushed out. Spinal stenosis is just a closing down of the gaps between the bones. So we have openings where our nerves come out of, and stenosis is just when they start to close down. That's all that means. And then sciatica, they started using as a blanket term for nerve pain in the leg, which we'll get into in a little bit. But a lot of times physicians will literally write a diagnosis of sciatica when something isn't even sciatica, just because somebody feels something anywhere in the leg. So the reason I want to go over these is they are scary words. They do mean something, but they're not the end of the world, right? So if you ever get imaging done or a doctor says you have something like this, you shouldn't let it freak you out. These are all things that are actually treated conservatively. So non-surgical for the most part, completely treated. I've treated every single one of these things in physical therapy. All right, so let's dive into a couple of these. So, spinal stenosis, like I said, is just a closing down of the joints in the spine. Most of the time with spinal stenosis, this is where you see like bending forward feels good. You see a lot of old people bending forward on their walkers, things like that. Every once in a while, people have nerve symptoms associated with it. But anymore, we consider it age-related change, and a lot of people are asymptomatic. So even though it might show up on an image, doesn't mean you have pain. And when people do have pain, there is positive correlation with making good health choices and exercising. So keeping yourself strong, keeping yourself in shape, sleeping well, hydrating, all the normal things, that all shows that there's positive correlations with the pain associated to spinal stenosis. Disc injuries are a big one. They're the one that I think cause the most stress for people. The reason being, I think, is, we get worried about the disc herniation and stuff pushing out onto nerves, which can happen. But the good news is, kind of the worse the disc injury is, the faster it heals. So disc bulges, where nothing is popping out, tend to heal at a slower rate compared to disc sequestrations, where you have a bunch of that nucleus pulposus popping out. Those actually heal at the fastest rate. And they think it's because the body kind of sees it as an emergent situation and then just jumps into a healing process. It's like 97 or 99% of disc herniations with severe sequestration heal. But a couple things that we want to nail down here is, one, everybody's heard the thing disc slipping. That's not a real thing. Your disc cannot move. It is stuck between your vertebrae. It's not going anywhere. They have a good healing rate, like I said, but they also might not be the root cause of your pain. So on imaging, if you took images of 100 people, most of them without low back pain, some of them with low back pain, we would all probably have some type of disc diagnosis, right? I probably have a few disc bulges, maybe a couple disc herniations, but I don't have low back pain. Just because I have something doesn't mean I have pain, and just because you have pain doesn't necessarily mean it's coming from that thing, right? There's a lot of different triggers to this. So again, the whole point, don't let that stress you out. Now, with disc pain, a lot of times we have the associated nerve pain, right? Sciatica is the word that I had previously brought up. What sciatica actually is just irritation of specifically the sciatic nerve. So that would be pain that goes pretty much from your glute. It can go down your hamstring, and it can either go like into the calf or to the outside of the leg, because it branches off kind of behind the knee there into two separate nerves. The better term for what we would call like quote unquote sciatica would be radicular pain. So that's any pain down the leg that's associated with the low back. And radiculopathy is numbness, tingling, muscle weakness, or anything like that that's associated with the pain coming from the low back, okay? Sciatica, we talked about, was a specific nerve. You have multiple other nerves that also innervate the muscles in your lower leg, and we can actually break that down and diagnose which nerve is actually affected, so that you're not walking around thinking it's sciatica when really it's something else, and Googling sciatica exercises when actually it's something else. So the only time that nerve pain, I would say, is like a really big problem, one, obviously, if it's not going away and you can't walk and the weakness is getting worse or something, clearly a big problem. But things to definitely go get assessed for: if it's causing any sensory issues in the genitalia, you're having bowel or bladder incontinence, if it's going down both legs, anything like that, just see your doctor right away so they can assess you. But like I said, PT has been shown over and over again to be something really positive to help with nerve pain. I've had a lot of clients who are competitive lifters and runners who have had really severe nerve pain down the legs. We can manage that, get that away, and they can get right back to competing and doing what they love. Arthritis, and we're almost done with the diagnoses and getting here to the good stuff, I promise. Arthritis, just a blanket term for joint inflammation. Again, normal age-related changes. The pain can often be debilitating. I'm not knocking it, but there's often a lot of negative associations with it. Sometimes people go get imaging they're told they have arthritis and the world ends, right? So when it comes to arthritis, if you ever get imaging and you see that, or even something with the term quote unquote, like bone on bone, don't let that freak you out. You can get better. It just takes some time, takes some effort. The things that help: sleep hygiene, get good sleep, right? If you get good sleep, inflammatory response goes down. Arthritis is joint inflammation. Nutrition, well-rounded diet, 3 meals a day, protein at every meal. Eat your fruits and veggies, kids. And then the last one, my favorite one, exercise. So give you a good example: someone who has arthritis, when they wake up in the morning, they're usually pretty stiff. They haven't moved at all, but they feel better when they get up, they move around a little bit, maybe they take a hot shower, they walk downstairs, and then they go outside and take their dog for a walk, and then they don't have pain for the rest of their day, right? It's because with exercise, we're actually recycling some of that inflammatory fluid out of the joints and promoting healing factor, and all of a sudden they start to feel better. So with arthritis, exercise is your number one tool. All right, time to dive into the good stuff. So training with low back pain. The one thing I'll say is anybody that's ever come to me with low back pain, they have never had to stop training, and nor will they ever have to stop training. We're going to find ways to maximize what they can do in training, but also adapting it to whatever they need for rehab to make their outcomes even better. Me personally, I've had a couple back injuries, and each time I've come out of one, I've hit a PR. I've hit a PR on my deadlift, and I've hit a PR on my squat. I've been able to take the time to focus on my weaknesses despite my injury, come back and do something pretty cool. So do not think that you have to stop training just because something hurts. So the first thing, what to do on your own, right? You have an injury, it sucks, don't panic. These things happen. As long as you're still able to like walk out of there and it's not an actual emergent situation, like it's an injury that you don't have to go to the ER for, don't panic, right? I would recommend seeing a professional. So physical therapy is a good go-to, especially with musculoskeletal injuries, because we can do differential diagnosis to see if it's something that we can treat or if you actually need to go see a specialist for it. I think it's like 95% of cases can be treated conservatively. So more than likely, if you go to PT, it's your one-stop shop. You don't have to go get imaging and go through all the other doctor's appointments before you get to PT. You can go right there. Managing your variables. This is probably the most important thing you can do on your own. So like we talked about when we were going through arthritis stuff, sleep. When you are injured, you need to maximize your sleep. I know that's not a perfect thing for everybody. There's parents and people with crazy work schedules and all sorts of stuff out there, but maximize what you can, right? Obviously, 8 to 10 hours is optimal. If that's not optimal for you, if you can only get 6, you get 6. If you can only get 5, you get 5, but maximize what you can. A lot of healing takes place when we sleep. And like we said, sleeping decreases the inflammatory response. Nutrition. I tend to tell people to almost push calories a little bit. You want to give your body enough fuel to promote healing. And like we said, we're still training, so we're not too worried about, weight gain, loss, all that stuff. But you want to push protein, make sure you're getting all your vitamins, vegetables, fruits, all that stuff, and really just push your calories, make sure you're eating enough. Hydration, this doesn't stop, right? So I think the recommended water intake right now is for active males about a gallon, and for active females about 3/4 of a gallon at a minimum for the day. That's assuming that you actually have like a good nutritious diet as well, so you're not getting hyponatremic or anything like low sodium. But hydration, super important. It also, our joints, our muscle tissues, everything, they all rely on water, right? So water goes in, it's going to go to those areas, it's going to help you. Stress actually is another one. So pain, believe it or not, can be triggered by stress by itself. So it can be stress because of the injury, it could be stress from other things, but stress does affect our pain response. Just with the chemicals, released in our body, it can be triggering to some of the nerves. So finding ways to help with stress management, very important. So that could be, reading or taking some time away from, whatever's stressing you out if you can. Just find a way to help yourself manage your stress. And then the last one is adjust your training as needed. And that's what we're going to dive into a little bit. So, one of my favorite quotes actually comes from my old wrestling coach, Dr. Craig Miller. Shout out Dr. Miller. He said to me once, quote, "If you hit your thumb with a hammer, are you going to move it before you swing again?" So I think he said this to me because I had my foot locked up. I think I cramped, and we were trying to run 400s outside, and I was limping, and pretty much just kept trying to go, and he yelled at me for it. So I never forgot the quote, though. But pretty much what it's saying is if something is being pissed off or it's really aggravated, don't keep doing that thing if it's just continuing to re-aggravate the same issue, right? You want to find ways to adapt and address what you're doing to make progress without making your symptoms any worse. So the cool part about injury is it does give you a little bit of a gift, right? The gift of injury. That's actually a book now written by, I think he's a former powerlifter, Brian Caroff. But injury is cool in the fact that although it sucks because you're hurt, it does force you to take a step back, and it can give you the space to work on the things that are weaknesses for you, right? So areas that you might have neglected because you've been so focused on training for a specific event or a specific movement or whatever it is. When you're injured and you can no longer do that one thing, the other things you can do are probably things that can address your weaknesses. So although you're dealing with a lot physically and mentally, try to look on the positive side and be like, well, now I can get stronger in the things that I kind of sucked at. And when I come back from this injury, those things are going to be a lot stronger. And here we go. It's time to hit some PRs, right? So when we're training with low back pain, the number one thing you need to do initially when you go to like figure out what to do is figure out what triggers your pain, right? So this could be a specific movement like bending forward, bending backwards, rotating. It could be how much load you're lifting. It could be how fast you're running. It could be how long you're lifting or how many reps you do or how long you're running. It could be just at certain ranges of motion. Whatever is triggering your pain, you need to identify that. When you identify that and you know what causes it, then you know you can do something about it, right? So obviously, like when I see people who have hurt themselves, let's say lifting, for example, it's a pretty acute injury, like it just happened. Usually things are pretty flared up, but oftentimes we have specific movement associations with pain. So like bending forward to pick something up might hurt really bad, or bending backwards might hurt really bad. And it's really key to start to hone in on those things when you're trying to figure out what to do. So when we're getting started, biggest thing, warm up, right? So we've identified our trigger and we know what hurts and what doesn't hurt. So we're going to include that in our warm up here. So warm up when you're injured, I tend to give a little bit of a longer warm up. And the reason being is we want the body to feel really good and kind of optimize ourselves to be able to train so we can get the most out of our training. What I do with a warm up is I break it down into a few parts. So we always do some type of aerobic activity or blood flow. We need to get our cardio in. Desensitization, this is where the triggers come in, right? So we need to desensitize the low back, make sure that it's feeling pretty good. Do some type of mobility or stability movements based on the reason why you're having, the injury. We do some activation that's going to prep us for whatever we're planning to do that day, whether it's a specific barbell lift or it's, a run or whatever. And then it's execution. It's getting into our plan for the day. So when it comes to aerobic activity, I generally recommend like 3 to 10 minutes. This is still part of a warm up, but the goal with it is to get your heart rate up and get blood flowing, right? So this could be a brisk walk. This could be hopping on the bike. This could be, on the treadmill, get on the elliptical. I don't really care. The row machine, it doesn't matter to me. The goal is to get your heart rate spiked up a good bit, maintain it, get the blood moving. Like you should be out of breath at this point when you're at this part of your warm up, right? And we're only at the first part, but I promise you, if you do this, you'll feel a little bit better. So there's a lot of research that shows positive results with just aerobic activity and low back pain. So just doing some type of aerobic activity on its own correlates with lower pain levels in people that have chronic and acute low back pain. Okay. And we often just neglect cardio, guys. You got to get some type of cardio in. I promise it's helpful. Um, Desensitizing, where your triggers come in. So blood's flowing, we're feeling good. Now let's have an example here. Let's say like bending forward hurts. Okay, so if bending forward hurts, I just got off the treadmill. I did a 10-minute walk. I'm gonna come over and I'm gonna do some things to help my back feel even better, right? So I'm gonna do maybe some prone press ups, some bird dogs with extension, and maybe like a few Supermans to get my back primed up and ready to go. So I pick like a couple movements that make me feel good, and then what I also want to do is pick a movement or two that is going to start to reintroduce the painful movement. So we're not just bending forward into that painful range right away, but maybe I'm going into like a cat cow and just like slowly pushing into it, or maybe I'm going into a child's pose and just easing back into that painful range of motion. So you want to like ease into it a little bit. So do all the things that feel good, get yourself ready, and like mixed in with those, pick a movement that feels not so good but tolerable and kind of like slowly ease into it with it. So between the blood flow stuff that you did and then desensitizing, you should actually notice that you can get further and further into what was a painful range of motion. After we finish that, we get into either mobility or stability work, or sometimes both. It just kind of depends on what you need, right? So generally speaking, with a lot of runners and lifters, which is what I primarily see, most people they're not mobile. We have tight calves, we have tight hips, we have tight hamstrings, we have tight everything. There's some people that are hypermobile, and if that's the case, generally with hypermobility, this is the point where I start to introduce some stability based exercises to kind of get the body primed for our activation stuff and then execution of what we want to do that day. Stability exercises are also fine if you're not a mobile person. I just generally tend to take this time to focus on some of the mobility that maybe we have been lacking and might have contributed to why we got the injury in the first place, right? So, like, for example, on a deadlift or a squat, sometimes if our hips aren't super mobile, we're going to have a little more force through the low back. And if that's how we hurt ourselves, might as well work on our mobility now, right? So mobility and or stability is the next phase that we go into here. Then activation. So like I said in my example, bending forward hurts, it sucks. Now I've gone through my blood flow, I've done my desensitization, kind of worked into some of that bending forward movement a little bit. I've done, let's say I did a little bit of hip mobility and maybe some side planks or planks for some stability as well. Now I'm going to get into some activation. So my goal for the day is, let's say it's to do some type of squat movement, right? So activation would be for like my quads, my glutes, move like anything that's going to get those warmed up and ready to go as well. So I already kind of took care of the injury. I'm feeling really good. Now it's time to get those warmed up. So maybe I'll do, if I need to, I'll do like back off, I'll do quad extensions. Maybe I'll try like some split squat pulses, hamstring curls if I can't bend forward with any weight to do any type of hinging. I try some things like that to like get the body primed and ready to go, feeling good, and then try to make it as similar as you can to the movement you're executing. So maybe I'll try some pulse squats, kind of slowly working down into the range once I'm feeling good, and just kind of work on getting there. And then we get into execution. So you made it. It's time to hit your goal that day. So my goal is squatting that day. I'm going to do a high box squat, we'll say, because it hurts when I go down to the bottom or something. So in my activation, I started doing some pulse squats, slowly working into my range. Now it's time to execute. I get under the barbell. I start strictly with the barbell, and my goal is to perform it perfectly. If I'm running, for example, my goal is to start turning over. And if I'm shortening my strides that day, I'm making sure my foot strike is perfect every time. My stride is perfect every time. If it's pace, I'm making sure I'm hitting my pace right. Whatever it is that I'm using to manage my symptoms. With a barbell, it's executing perfect form every time for the lift, for whatever modification you're doing. So I know that's a lot to say because it seems like the warm-up takes a while. All of that probably takes about like 20, maybe 30 minutes if you just kind of go with it. Like we said, let's get some cardio in. But I think it's really important. It allows you to almost like hit your rehab stuff in the beginning, start to get pain free, and then allows you to really focus on your goal that day. Okay. So, timelines, diving into how long this will take you to fully heal. Unfortunately, I can't give you. I need to get rid of this little thing, huh? Sorry, guys, I just saw that. With the timelines, I can't give you like a legit, it's going to take this long kind of answer because there's a lot of variabilities that play into that, right? We're all different people. Injury is going to be different. Injury history is different. How long you've had the pain matters. There's a whole bunch of stuff. So what I'm basing this off of is pretty much just like an acute, musculoskeletal type injury. Maybe we have like maybe a disc type pain or a really bad muscle strain or something like that, right? So generally, and you can see these timelines are pretty long. Phase 1, 3 to 6 weeks. That's just kind of taking the pain down. That's the whole goal for this one. We back off on whatever's making it mad, and then find ways to keep our body strong and just focus on decreasing symptoms. Phase 2, this is where it gets a little tricky because this phase more than likely is the longest phase, right? So I said 4 to 12 weeks. Some people are lucky and it doesn't take them very long. Other people, it takes a little bit longer, and that's okay. Everybody's a little different. With all of my different injuries, the timeline has been completely different on each one. But in phase 2, we're starting to reintroduce specificity. So we're getting back into, what we were doing previously that was aggravating. So if that was squatting or deadlifting or bench pressing or overhead pressing or running or jumping or whatever it was, we're starting to reintroduce those things, but at levels that are manageable. So they might not be the specific like barbell back squat that we want to do, but it might be starting to get into some like front squats or something like that. It might not be 12-mile runs at a 6:30 pace, but we might be able to start reintroducing alternating 2 miles on, 1 mile off at like 7-minute pace to 9-minute pace, and just getting like slowly chipping away at that, monitoring our stride or something. So this is where we start to reintroduce specificity, but you continue to work on your weaknesses in this phase as well. So we don't stop that part. We continue to address our weaknesses, strengthen our body here, because when we get to phase 3, this is when we are reintroducing the previously aggravating movement and really honing in on the motor pattern of what that was. But now we've addressed our weaknesses, so that no longer is going to hold us back, and we can really just hone in on getting our motor pattern back to where we want it and going back in and hitting PRs eventually, right? That's kind of the goal here. So although we have pain, following kind of this outline, we can come out of it on the other side and be stronger. So here's a nice little picture for you that I made just to show what this looks like. So phase 1, like I said, dropping down pain, that's your whole goal here. You're addressing your weaknesses, doing whatever you can to keep your body strong. Phase 2, starting to increase the specificity, continue addressing the pain as it flares up, and then continue progressing, whatever exercises you were doing to address your weaknesses. Phase 3, we're getting back at it, baby, slowly progressing in that specificity, progressing our load, progressing our volume, progressing our frequency, and then getting back at it. So how to manage your symptoms. When we're training, we're going to feel pain. When we have an injury, it's just going to happen. Now, I don't like people pushing into pain a lot. I think a little bit is okay. So like noticing it, we'll say, is fine. But you want to keep your symptoms manageable. So the way that I kind of like to explain it is if pain is a line, right? So we have this line where that's like our threshold for pain, like that hurts too much. When we're training, we're allowed to scooch up close to that line. Sometimes we can even touch that line, but we don't want to cross that line, right? Because crossing that line means when we hit it, it stays there. But if we keep getting closer and closer, over time, that line is going to keep climbing up and climbing up. And so eventually it's just going to kind of go away because we'll never actually truly hit that line of like a pain threshold. So it's okay to notice things, but you don't want to push into it to the point where it's legitimately painful. That's kind of going backwards a little bit. If it happens, that's okay. You just don't want it to keep happening. What I recommend you do, though, is you track your symptoms during training, how you felt, like how close you can get to that pain line with certain movements, at what point of range of motion, like how you're feeling when you're doing these things. Track your symptoms after training. So you say you went through training and it felt great, but afterwards you're debilitated. That means you probably did too much. It's not like you could have known. It didn't hurt while you were doing it, but it hurt after. So now we know the next time we go in, we back off a little bit, right? And the other thing, kind of going in with tracking your symptoms after training, we continue to track our symptoms the next day. So I trained, I felt good. After training, still felt pretty good. I wake up the next day and it hurts like hell. Not great, right? So that's another cue to be like, okay, overdid it. I know I felt good. That felt good, but it was clearly still a little too much because I woke up the next day, could barely move. So we know to back it off a little more and then like slowly work it up again from there. So just remember, discomfort's okay, but you shouldn't necessarily be like truly paying for it either during or after you train. Now, exercises. Everybody likes to ask like what exercises to do. So there's like a whole encyclopedia I could give you of exercises, but I just decided to go with some of the more common diagnoses that I see, which is like flexion insensitivity, or if bending forward is painful, or extension insensitivity, which, you know, if bending backwards is painful. So if you want to desensitize, so if bending forward is painful and you kind of want to desensitize the pain or make the low back feel a little better, I usually recommend doing some type of like prone press up, a bird dog with some extension. Cat cows are great for both exposing a painful range of motion but also desensitizing because you're doing both. One of my absolute favorites is Hindu push-ups. They're not a very common push-up variation you see. And if anybody's interested, just message me in the chat and I can send you a YouTube video when we're done. But Hindu push-ups are an awesome flexion and sensitivity, like desensitizing exercise, because it puts you in lumbar extension. But it's also a great way just to get some shoulder and arm work in too at the same time. And then Superman's, you know, laying on the ground, flexing your low back. But progressions for flexion, so to how to like reintroduce that movement, I generally start with some type of cat-cow. There's a PVC lat stretch you can do on a bench with your elbows on the bench and kind of rocking back into a little bit of a child's pose. Then you can also do like a child's pose, a seated ball roll, just rolling it forward, rolling it like forward and out to the side. Then once those things are all feeling pretty good, we get right back into, you know, hinging. So PVC hinge movements where it's not very loaded, but you can practice the movement. Then we can start loading into RDLs and eventually get into something like a Jefferson curl where you're actually like rounding your spine the whole way down and then rounding it the whole way back up. And then on the opposite side, if extension is painful, to desensitize it, you wanna go into flexion or like rounding of the low back. So knee chest stretching, child's poses, crunches or curl ups are good. Leg raises, knee raises, planks where you're really trying to like dome your abdomen. Those are all pretty good. And then to slowly work into extension, cat-cow, like I said, easy one. You can really kind of grade how far you're going. You're supported on 4 limbs. Seated extensions, really just like arching your back and kind of almost twerking in your seat is an easy way to think about it, right? So just nice and easy, just kind of arching the low back there and just kind of pushing in as far as you can, just slowly grading towards that line of pain, but not hitting it or jumping over it. Prone hip extension, so just laying on your belly and lifting your leg straight up. You can also bend your knee and do it that way. Although it's mostly a glute exercise, your low back does have to have some degree of extension to do it. You're never truly going to isolate it unless somebody like holds you down. And we can get into things like 45-degree hip extensions, back raises. There's your Supermans, you know, that we had for desensitization of the other one, like those can go in there. There's a whole bunch of stuff that can go in, but you like slowly want to progress it. So you don't want to jump right from not doing anything to doing like loaded back raises. That's not going to feel so good, right? So I wrote these in a sense of if you were to follow these kind of step by step, it should be like a progression for you. All right, so making adjustments when we're training. So this is kind of one of the bigger takeaways I want you guys to have is like when you hurt yourself, you have low back pain when you're training, you need to know how to make adjustments, right? So when we think about what we do for our sport, whether that's running, lifting, or any specific ball sport, we have certain movement patterns, right? And what makes us good at those movement patterns is practice. So people who can, you know, run really fast for really long, they're really efficient at their turnover and their gait. And like, yes, they're in very good shape, but the reality is they're really efficient at that motor pattern. People who can squat a lot of weight, they're very efficient at that squat pattern, right? So what we don't want to do is lose that pattern. So we do something to train that pattern, but do it in a way that is less painful. So like if a back squat hurts me from my example before, maybe I'm going to switch to a goblet squat or like a high bar, high box squat. So you just find a variation that works where you can still train the pattern. It's not going to be perfect, but you can really focus on it and you won't lose the skill necessarily. And then as we're working on our weaknesses and continuing to strengthen the body, you're actually not going to lose the strength either. So like I said, there's ways around it where we're still managing the injury, but not losing too much of the skill or the practice, and we're still maintaining our strength. Other things to think about: decrease load. This is mostly targeting my, gym bros out there who get stuck on, I got to lift heavy because that's what I'm here for. You don't have to just lift heavy because that's what you're here for, right? Remember the thumb and hammer quote. If it hurts, don't keep doing it. So take some weight off. We can adjust volume. We can adjust sets. We can do a whole bunch of stuff. But if that compression force is causing pain, stop it. Just take some load off. Decrease volume. This is where runners, I'm yelling at you. You tend to not want to drop your mileage, even though everything hurts. So when you're having low back pain with running and you keep pushing your mileage because you feel like you have to for whatever reason, that's not true. There's other ways to keep your body in shape and other ways to, like, quote unquote, get your mileage where you're maintaining a certain, sorry, Ward, not trying to call you out, but it happens, man. Where you try to maintain a certain like heart rate for a certain length of time, right? So when you are running and you're having low back pain and say you need to get, like, you were originally programmed 60 miles that week or something, you should definitely back off. Let's say you back it off to 20 miles. Yeah, I know that's a big chunk, right? 20 miles, and your pace is coming down too. We're just keeping the running in so you can kind of practice some, just a little bit of turnover. We're keeping some of the skill. We're probably going to change stride a little bit, change pace, whatever that is. But we're going to include, maybe you have swimming workouts, or maybe you have the bike or the rower, or maybe we're doing some sleds. Sleds are a great exercise for runners. We'll find other ways to keep your fitness up and still keep the skill acquisition in of like the running, right? And the last one is decreasing frequency. This is the hardest one because, we get in our routines. We have to go to the gym 5 days a week or whatever it is. You can still do that, but you want to decrease the frequency as to which you're doing the aggravating movement. So if, for my previous example, if I was squatting 3 times a week, that's not going to work. If squatting already hurts me, I can't go in and do it 3 times a week like that, right? And I'll have examples later of how to like help change your programming around so that you can adjust your frequency and everything, but you need to decrease the frequency in which you do that aggravating movement and just find other things to do when you're there. So still set aside that time, that's fine, but find something else to do. Like, just change your schedule up while you're in the gym. So some examples. So for squatting, heels elevated goblet squats, especially if you have pain, like with rounding of your back or bending forward, that's a good one. Goblet squats just in and of themselves, it keeps you a little more upright. Then you get to front squats. Zercher squats are a great way to keep your trunk upright, but still like load the spinal musculature, where you're like resisting flexion. So I really like using that variation. And for those of you who might not know, Zercher squats are holding the barbell like in the crook of your elbows. So you kind of like bend your arms up and then keep the barbell in there. And then you can get into your high bar back squats and low bar back squats. There's different bar options like cambered bars and safety squat bars. Loading options, you can use chains, you can use bands, weight releasers, all sorts of different stuff to help you manage loads, higher, lower, in the range of motion. Something you might have to play with. Definitely something that I use with a lot of my clients when we're trying to get back into squatting. Bench pressing. Generally speaking, bench pressing isn't super painful. with low back pain just because it's not being directly loaded. But every once in a while, especially for people who are extension intolerant or bending backwards hurts, it can be some options. Getting your feet up when you bench, doing floor presses, getting away from like a heavy barbell. Um, Often just the load in and of itself, just switching away from it can be helpful. Use your dumbbells, use your chains, suspend some kettlebells. That's a really easy way to make the load lighter, but also just as difficult. Deadlifting, we get, really just backing off and kind of working back up to a barbell, right? So we start with like a PVC pipe. Maybe we get into some dumbbell hinging. You can try, if you deadlift in a closed stance or conventional stance, try a sumo stance where your feet are a little wider. It loads your hips a little easier or a little more and loads your quads a little more. Trap bars are an easy one. They load your quads a lot more and actually keep you a little more upright, especially if you use the high handles. So just use the equipment you have available to you. If you don't understand or know what to do and you're confused about it, just email me. I'll help you out. Running, couple variables here. Stride length, you might have to decrease or increase your stride length. The surface that you're running on, hills, up, down, flat surface, whatever is the most comfortable, stick to it. Pace, you might have to go a little slower for a little bit. Rarely do I see people have to go faster. Every once in a while, it's kind of the case, depending on how their foot strike is and how they're landing when they're going slower, but pace, adjust it. Faster, slower, whatever you need to help you manage your pain. And then, like I said before, frequency and volume for runners. We just need to make sure that your mileage is manageable, and then we can, adjust keep your fitness up as able with other things. So this is an example. I have a lifting example and I have a running example for you guys as to how to kind of adjust your own training structure to make sure that you're able to still address your pain. So let's say before I got hurt, I would squat on Monday, bench on Tuesday, deadlift on Thursday, and then do a squat bench combination on Saturday, right? But now I'm hurt and it hurts to squat and it hurts to deadlift. So I'm still going to go in on Monday and I'm going to squat, but my focus is a goblet hold split squat. So I'm going to isolate just one leg at a time, stay a little more upright. It's a little less sensitive. And then I'm going to do my rehab exercises and then just some hypertrophy stuff, single joint, like quad extensions or whatever it is. Bench press doesn't hurt. I'm going to keep it the same. We'll just do that just in the example that I'm giving you. Thursday is where I'm going into that high box squat that I was telling you guys about. And then I'm going to also practice my hinging. So this is where I'm going to practice like with the PVC pipe, just slowly working down through that range of motion. I'm also going to work on my rehab exercises. And then on Saturday, I'm still going to bench press. And then I'm just going to work on building my legs up. Right. So I'm not going to add another squat day. I'm going to decrease my squat frequency because that's triggering for me. But I am going to go do some quad extensions and I'm going to go do some hamstring curls and different things to help build the muscles that actually allow me to be a good squatter. For running, so let's say Monday I was doing a long run. Tuesday was a track workout. Wednesday was a gym day. Thursday maintenance run, and Friday was another gym day. After I got hurt, I can't handle the same mileage. I can't handle the same pace. So Monday, big time warm-up focus, easy run. We're feeling it out. We're seeing what pace and stride looks like, what that needs to be. Tuesday, if I don't have any symptoms, I'm still going to keep a workout in. I'm just dropping it back in what I was doing. So we're just going to do like a half mile at a faster pace than I did Monday and then a slower pace than I did Monday for 1 mile. So that's kind of what the workout's going to be. It's a lot less than you want it to be, but it allows you to play with pace a little bit still. And again, skill acquisition. Wednesday, we're still training the upper body, doing our rehab exercises. Thursday, we're going to do a warm-up focus no matter what. And then we're either going to go for an easy run based on how we feel, or that's our secondary like fitness day. We're doing a hard cycling workout or we're doing swimming that day. So although we're not doing our maintenance run, we're still getting working to keep our fitness up, right? And then Friday, we're still keeping our lower body training day through pain-free exercises. So maybe previously we were squatting and that doesn't feel so good right now. So now we're going to go in and we're going to go do sled drags, or we're going to go, do some split squats or something like that. So we still keep it in and do what we can to manage it. Just the training in and of itself is going to help increase blood flow and promote healing. So main takeaways: injury happens. Don't panic. You don't have to stop training. Your spine is not fragile. It's not going to break. I promise. You can make it through these injuries. Injury and debility are not the same thing. Um, Odds are, no matter what, you're going to heal. You're going to get back to doing what you love as long as you follow the plan, stick to the plan, manage your variables, and just be patient with the process. It does take time. Doesn't matter what the injury is. Very few of us actually get lucky and can bounce back really quickly. Okay, so always see a professional that understands what you do and the demands of your sport. Um, to help you get back to what you love doing. So now I'm going to open it up for questions. You can type them in the chat box if you would like, or if